Hello, this is Dr. Routman. I'm about to go over with you what it is you need to know if you're considering shoulder replacement surgery. The overview of this presentation is what is a shoulder replacement and why do people have their shoulders replaced? How do I do a shoulder replacement surgery? What should you expect if you're having a shoulder replacement surgery? What are the ways that you can mess up a shoulder replacement? And what are the risks of surgery? To start with, what is a shoulder replacement? A shoulder replacement is an operation that replaces the ball and socket of the shoulder joint with low friction metal and plastic material. After the operation, the movement of the shoulder is dependent on your own muscle strength. There are different types of shoulder replacements. Both anatomic and reverse shoulder replacements can be done. An anatomic or standard shoulder replacement replaces the ball with a ball and the socket with a socket. This is really only for patients that have arthritis with a good-looking rotator cuff. A reverse shoulder replacement inverts the joint, replacing the ball with a socket and the socket with a ball. This can be used in situations where your rotator cuff is not so good, and it can also be used in salvage situations where there are other things wrong with the shoulder that would make a standard shoulder replacement a bad idea. This is what the replacements look like. On the left, you can see an anatomic shoulder replacement where the ball has been replaced by a ball. But if you look on the right, you can see that the ball is attached to the shoulder blade, inverting the joint. How do I perform the surgery? Well, it's done through an incision in the front of the shoulder. After we go through the skin, the rotator cuff is usually taken off the bone surgically and repaired at the end of the operation in most cases. This becomes important later. I usually use very little to no cement when doing shoulder replacement surgery. We give you antibiotics that last around 24 hours, and there will be a scar after the operation, but most patients are pretty happy with the appearance of the scar. The anesthesiologist before the surgery will interview you and determine whether you are a candidate for a nerve block in addition to general anesthetic. We like nerve blocks. They're very effective and they help patients with pain control after the operation. Most patients go home the next day after surgery very comfortable, but there are some patients that can have this operation done as an outpatient or same-day procedure where you go home the same day of the surgery. If this is interesting to you, let me know and we can talk about it. You will have a sling and an ice device applied to your shoulder on the day of surgery and you'll be able to take them home. There are fancier versions of both the sling and the icing device that are available. It's not usually covered by insurance, but if you're interested, let one of us know and we can talk about it. You'll be provided with prescriptions for your pain medication for after surgery, usually on the day in the office when you're talking about consent with me. Please don't take your post-operative pain medication before the operation or you won't have medication for after surgery. You will have a prescription for physical therapy, occupational therapy, and nursing that will arrange for you to have these people come to your house during the first week after the operation. Your stitches will be removed at around a week after the operation. After this, you can shower and get the incision wet. Before this, you'll have to use a sponge bath. Sleeping immediately after the operation is easier if you have a recliner. Laying down in bed, it's harder to maintain the same position throughout the night, and using a recliner just makes it a little bit easier. Physical therapy can be required depending on the type of replacement that you get done. Reverse shoulder replacements don't usually need physical therapy. How can you mess this up? Well, early on, you can cause problems with the shoulder replacement by doing too much or too little, or by placing the arms in positions of danger. If you have a standard shoulder replacement at the end of the operation, a rotator cuff repair is performed. And if you use the arm too much after the rotator cuff repair, you can pull apart the repair that I do in the operating room. Later on, after you've had a healed shoulder replacement, trying to see how much the arm can take ends up being a problem for some patients. In my experience, people who want to see how much their shoulder replacement can take always find out. What are the risks of surgery? Well, with any surgery, there's risks of infection or nerve or blood vessel damage, but those are really rare. With shoulder replacement surgery, instability and rotator cuff tearing and loosening of the implants are also possible, but fortunately, these are very uncommon. What you should expect is that if you have a shoulder replacement, that you will do very well, and that your ability to return to the things that you want to do will be reliably restored. Thank you for your attention.